Heart. The size of the heart, what do you expect? Will it remain same? So, hypertrophy. Okay, physiological hypertrophy. One of the classical examples of the physiological hypertrophy, okay, in a woman is pregnancy. Okay, women usually don't play sports most of the time, you know that. Okay, in many parts of the world, women never play sports. Okay, even though they can, but they don't usually because of definitely the cultural issues and the responsibilities. They don't have time. Men, yes. Okay, boys, yes. So they have hypertrophy of the heart if they are doing weight training or athletics or like this. But what about the women? Women example is pregnancy. Okay, it comes automatically. During each pregnancy, heart has to grow. Not functionally, structurally, my dear, first of all. Functionally, yes. But before that, structurally. Structurally means that it's hypertrophy. And imagine how much hypertrophy has been observed. I give you 10%, 20%, 30%, 40%, 50%. What do you think? Okay, so you are safely choosing the middle figure. Okay, not here, not there, not the extremes. Okay, but take a risk and go to the extremes. In that case, it goes to even 50% really. Okay, can you imagine? It's kind of unbelievable. It is a reversible hypertrophy. It is a reversible hypertrophy. Heart gets back to normal taqriban after pregnancy. But in some of the pregnancies, yes, Abdullah?
Can this increase the risk of heart attack?
No, no. If there is a physiological hypertrophy, then there is no problem because it's an adaptation to the challenge or to the stress. It's a physiological stress coming on the body. There is no disease in the body. It's only a physiology changing. For that physiology, the maternal physiology is also changing and adaptation is being done. So this physiology, and obviously pregnancy is a 9-month period. After that it will be over and the heart has to return slowly. So alhamdulillah, there is no cardiac problem afterwards in the female. Okay, so this is the beauty of nature. So hypertrophy happens up to, I'm not saying in every pregnancy every woman develops 50% hypertrophy. Up to 50% has been seen in women actually. Okay, up to 50% has been seen. All right. Well, some changes in the ECG which are not significant, okay, but the heart rate increases, okay, because you need to increase the cardiac output. For increasing the cardiac output, you need to increase two things. Number one, heart rate, and number two, stroke volume. Both should increase. Heart rate increases 15%, or sometimes in the middle of the pregnancy or a little after middle, it's up to 25% also. But safely 15% is definite. Okay, it increases in the advanced pregnancy. 15% increase is seen, and that is a requirement really. Okay. All right. Because the pregnancy is developing, there is a slight tilt of the heart. Okay, the heart is having a movement upwards. Okay, it is towards the left side, and it slightly turns a little, and there is left axis deviation in the ECG also. Okay, there is an axis deviation. We can see the axis in the ECG, and that is also deviated. All right. Okay. One of the changes, what do you see in this picture? Okay, what do you see in this picture? Just try to see what is happening. Yeah. Yeah, it's compressing. Let us see this vessel, because this vessel is shown red. You are taking it as aorta, all right? I'm not saying you are wrong, but if I say this vessel is not aorta, then what else could it be? Obviously, such a big vessel along with the vertebral column. And think logically, if you have aorta and if you have vena cava and there is a pressure coming on, which is easily compressible? So aorta is very tough. It's not easy. Even if you apply the pressure, it's very strongly muscular, isn't it? It's a muscular pipe. And vena cava is a soft pipe, isn't it? If you just apply the same pressure, vena cava will collapse because inside pressure is also very low and outside wall is also less muscular. Okay, because of these reasons, a slight pressure coming on from the uterus, a heavy uterus, when the female is lying down in this position, supine position, okay, there is compression of the vena cava. If the vena cava is compressed, what will happen, Shabab? That will be? Yeah, okay. Less flow inside the vena cava. So what will happen to the venous return? And what will happen to the cardiac output? Decrease. And then what will happen to the blood pressure in that case? Decrease. So there is a hypotensive state coming because of the low return and cardiac output issue, all right? So this kind of syndrome can develop in some of the females during the normal pregnancy. Okay, if the uterus is very heavy and they are lying in position, sometimes they feel less cardiac output and a fall in the blood pressure. Okay, this is called inferior vena cava syndrome. Now let us see please quickly. Okay, we are just doing things statistically and realizing that all the changes are happening in mother's cardiovascular system. Look at the parameters which are changing. Please look at the parameters. Left ventricular hypertrophy, do we agree with that or no? Okay, we talked about that. Okay, stroke volume is increasing, yes or no? Definitely increasing. And look at the value which is also written here. Not really have to remember all those values memorized, but just an approximation, an idea about it, taqriban how much it is increasing. Okay, so up to 30% or so stroke volume is increasing. Okay, so both stroke volume and heart rate are increasing. What will happen to the cardiac output? Okay, 40% increase or sometimes 50% increase in the cardiac output has been seen in the pregnancies. Okay, one of the reasons of increased cardiac output is that the venous resistance, systemic venous resistance or vascular resistance is also decreasing. Okay, if it is decreasing, what will happen to the venous return? Increase. And what will happen to the cardiac output? Okay, so you are making a connection here. Look at the blood pressures please. Okay, systolic and diastolic. Just see and tell me what is happening to both blood pressures, systolic and diastolic. Both are decreasing? Okay, and both are equally decreasing, do you think? No. Which one is more? Diastolic is more. And why is diastolic decreasing more? Because of venous resistance actually. Okay, when you are having vasodilation, that will affect diastolic pressure more. Systolic is also decreasing, but at the same time the cardiac output is increased. So these two factors are neutralizing each other. So some fall in the systolic blood pressure. Okay, in the early part of the pregnancy to the middle, there is a fall in the blood pressure. When the baby is about to be delivered, it means at the time of delivery, just before delivery, almost normal blood pressure comes back. Just as the pregnancy started, at the start of the pregnancy or in the non-pregnant time, the same blood pressure comes back to normal almost. Okay, so the blood pressure is reverted, it gets back to normal. But in the middle of the pregnancy, if you check the blood pressure, expect some fall in the blood pressure. Sometimes you might hear that there is a high blood pressure going on in the pregnancy, the pregnant women develop, but that is not normal issue. Okay, that is the pregnancy induced hypertension or high blood pressure due to some reason in the pregnancy. Normal women should have a slight fall or almost no change in the blood pressure. They should carry on like this. Okay, all right. So there is a fall in the mean blood pressure also. Okay, let us look at the hematology, the labs in the values of blood. Very interesting. Let us talk about these values. What is happening here? Look at it. Volume definitely increasing. The blood volume has to expand. In order to move properly and to supply to the fetus, you need to have an overload, an extra volume which is coming. Please, okay? That's one thing. For sure it increases. First thing, plasma volume, okay, is increasing, and the RBC mass is also increasing. But please look, plasma volume and RBCs. This is RBC, my hand, and this is plasma. These two are making the blood, isn't it? Overall. Now, both are increasing, but one is increasing more than other. Which one is increasing more? Plasma. If the plasma is increasing more than the increase, there is a proportional anemia, isn't it? A disproportion is there. They're not increasing in the same proportion. So this disproportionality leads to a physiological state of anemia, false anemia. It's not an anemia actually, but it's an apparent anemia. Physiologically, the hemoglobin levels drop because there is more plasma. And you call it physiological anemia or dilutional anemia. All right, we use the term physiological. So it may happen in the pregnancy. There is a fall in the hemoglobin level in the pregnancy. Actually, hemoglobin is not decreased from the baseline value. It is slightly increasing. But because more plasma is there and you mix it, then it becomes really difficult to sort out. Okay? So this is dilutional anemia which is happening. Yeah, what about the clotting factors? The liver is producing generally more clotting factors as proteins in pregnancy. There is stimulation of the liver and more clotting factors. Most of the clotting factors are increased. Few clotting factors slightly decrease, but overall increase. If the clotting factors are increased, then we call it, there are more chances of coagulation potentially. Okay, there is no problem, alhamdulillah, nothing happens, but there are chances. So we call pregnancy as a hypercoagulable state. There is a state of hypercoagulability physiologically. Okay, physiologically it happens naturally, you can't do anything. Okay, this probably happens, hypercoagulability. If we think logically, maybe one of the answers is that at the time of labor, delivery, there is bleeding also. And if there is a hypercoagulable state, then maybe there are chances that the bleeding can be stopped early because of more clotting factors. If there are less clotting factors موجود, then the reserve is less and the bleeding can continue for a long time also. Okay, so maybe this is the anticipation. Okay, all the adjustments are being done. Going back to the blood, the white cells also show a slight increase, especially the neutrophils, they increase, and there may be a slight fall in the platelets, okay, normal to slightly low platelets, and the neutrophils, they also show an increase. Okay, the lymphocytes, T cells, they show less function. Number is okay, their function is slightly depressed. And that could be a little danger, point of concern. What will happen? Immunity is slightly low. So functional state, the number is okay. Number is okay. Now you look at the, actually that slide should have gone before because we were talking about the cardiovascular system and in between we had a slide of hematology, but that's okay. Venous pressure. Venous pressure is affected in the lower half of the body, not in the upper half of the body. Why? Compression. Okay, it's all mechanical compression. In the upper part, the veins are okay. There is no problem in the upper limb veins or the thoracic veins or in the neck veins or the head veins. Why would there be? There is no problem. But in the lower, when the head of the fetus is growing, well, that enlarging uterus is compressing the common iliac veins of the mother, and these veins are receiving the lower limb venous return. So if you compress the veins, the back pressure inside the veins increases and there is chronic increase in the pressure and dilation of the veins. So the back pressure goes on and on and on, and it goes to the lower limbs, the deep veins. The veins become incompetent, their valves are disturbed, and there are chances of edema. The back pressure goes to the capillaries. So there are chances of edema. All right? You are doing the same thing, my dear. I will not continue the class, okay? Now you have to decide.